Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan and today the topic of our lecture is the central retinal artery occlusion. So it is one of the basic causes of sudden blindness. It can be a unilateral sudden blindness or either it can be a bilateral sudden blindness in a person. So it can be one of the causative factors and is one of the major causes that we're going to discuss today in this lecture. In the very first section, we'll be discussing the anatomy which is basically explaining the blood supply to the ocular structures and towards the orbital structures. So knowing this anatomy and knowing the blood supply of these structures is important because that is what we are discussing. The central retinal artery, it is a branch of the internal carotids, and that is what we're going to explain over here. What is basically, how is it basically bifurcating and what are the other branches of this internal carotid artery after it gives off this central retinal artery, which is supplying basically the retina, the macula, the optic nerve. So these are the major structures which are supplied by this artery. Then we'll go about and define the central retinal artery occlusion. When we say there is an occlusion of the central retinal artery, we mean by this that there is a blockage of blood supply to the major structures of the eye, which are basically helping the person to see. So if the blood supply to these structures will be hindered, it is going to basically affect the vision of that person. And usually the person is going to present to you with complaints of sudden loss of vision, and usually it is the central vision that is affected. This is the visual field is usually of a central origin rather than of a peripheral origin in these patients. So knowing the history of the central retinal artery occlusion, how was it diagnosed first of all, and what are the different research works that have been carried out in this field, that will be discussed over here in this very first section. Then we'll move on to the signs and symptomatology of central retinal artery occlusion. First of all, we'll be discussing the epidemiology. Epidemiology is basically concerning the prevalence and the relevant rates of occurrence of this disease, and whether it is a common disease or it is an uncommon disease. That will be discussed over here in the second section. Then the clinical features. So knowing a disease and knowing its clinical picture is very important over here to distinguish and to get to the differential diagnosis in this particular case that we're talking about. It can be either of the causes of the sudden loss of vision over here, and how can we distinguish the central retinal artery occlusion from the other painless causes of the sudden loss of vision. So this is again very important, and we'll be discussing the signs that are obviously noted down by the clinician himself or herself, and then the symptomatology, that is basically the presenting complaints of the patients. So we'll be discussing that over here as well. In the third section, we'll be discussing ophthalmoscopy. So once you have basically inspected the eye, that is the major concern over here, you have gone through the inspection of the eye and you have examined the patient on the slit lamp. You have gone through the other causes, for example, glaucoma, intraocular pressure has been calculated and you've ruled out glaucoma in this case. You have ruled out any anterior chamber infections or uveitis in this case. So then you're going to return to the ophthalmoscopy and the findings that you're going to look for in the ophthalmoscopy. The cilioretinal artery, how is it observed in the ophthalmoscopy? It's basically a major artery that can be seen quite visibly when you look at the retina, when you look at the fundus of the patient, and it is quite visible if you see any abnormality, that is if it is seen over there. There's a box trade appearance that is seen over there, that is basically indicating the blockage of the central retinal artery over there. Then we'll move on to the fundoscopy. So performing this fundoscopy on the patient, why is it important to perform this fundoscopy and what are the typical signs that you're going to look for? What are the other features? For example, it can be the cortical wool appearance that is quite common in the diabetic retinopathy, and we're also going to look for these signs and symptoms over here. If they are present, we're going to have the differentials in our mind. So in the fourth section, we'll be discussing the patient evaluation. So once you have a patient, what are the specific tests that you're going to perform on that particular patient? It's again very important. There are a range of tests out there from which you can choose for the major guidelines that have to be kept in mind. That we'll be discussing in this final section, and then we'll be moving on to the particular findings of the ophthalmoscopy. OCT is one of the tests that is performed. Then we have the fluorescent angiographies that is performed, that is basically known as FFAs. And then we have the immunofluorescence techniques, and the other tests that are quite frequently performed are the visual fields on that particular person. So I hope you want to learn more about the central retinal artery occlusion. So do watch the other sections to this lecture as well.